Eric Calciano is here with me now. He is the lead benefits advisor for New City Insurance, a company founded in 2008 looking to, as it says, reshape the insurance industry. I know a lot of folks are interested in this conversation and topic right now. And when you see these numbers, why is it so many people who pay for their insurance end up having trouble when they try to use it? What's the deal?
We're seeing an erosion in the quality of health plans over the last 10 years since the Affordable Care Act came into place. We are seeing that the quality of care that insurers are providing is being reduced year over year, while at the same time premiums are going up every single year, and the insurance carriers are also reporting record profits. So they're providing the least amount of coverage that they've ever provided with at the highest amount of cost, and with record profits on their end.
And to that point, because the problems have been much less when you look with Medicare or Medicaid and higher with private insurance. I mean, why? Can you dig a little deeper? Why is that, considering in most cases people pay much higher premiums for that private insurance? How is it that the quality is going down when the pay is so high?
Yeah, it's not entirely clear why we're seeing more denial of claims, because we're seeing about double the denial of claims for employer-sponsored and privately held health plans compared to Medicare, Medicaid. But it could be as simple as it's more often that those individuals that are on employer-sponsored health plans are on PPO plans compared to if you're on Medicaid, for example. Those are almost all HMO style, and with PPO, there can be a little bit more of a gray area of if something's going to be covered or not prior to receiving care. So that's likely one of the major components of why we see that there.
Okay, and what should people do if their insurance provider refuses to pay for medical care, since it's happening at a higher rate?
Yeah, absolutely. So there's a lot that individuals can do. If you've already faced a situation where you have a denied claim, then you always have the ability to appeal with the carrier. And also, if you have a plan sponsored through an employer, then you have a consultant associated with that account that works on behalf of the employee and the business to advocate for you. So it's always important to reach out to them, reach out to your HR staff, and have them essentially go to bat for you with the carrier to get your claims approved. If you don't have that, then again, you can go to the carrier directly to appeal those claims. But the other major component of that is heading it off before it ever becomes an issue. So individuals can, before they ever receive care, get a verification of coverage from their insurer, because 85% of claims are non-emergency claims. So you have that opportunity to check with your insurer before you ever receive care to confirm that this is going to be a covered service. And when you do that, that alleviates the issue from happening in the first place. And also just educating yourself on what your plan does and does not cover. Every plan provides a plan summary. And so understanding this is what I can expect to be covered versus what I should not expect to be covered.
Okay, so doing some homework before, confirming before, and in the event that, okay, something happens, put a claim forward. I'm curious, just quick follow-up question. What is the success rate of putting those claims in? Do you have that number?
I don't have that number offhand, but just in my personal experience, because that's something that I do as part of my job, is advocate for the members that I am a consultant for, and we have a lot of success. So when it comes to a claim getting denied, we see that very often these claims get denied almost automatically by the insurance carriers, and it does require that appeal process and some advocating either with the consultant or with the individual themselves going to the carrier and saying, hey, no, this is something that should be covered. Oftentimes it involves getting the doctor involved to write a letter and resubmit the claim, but the success rate is pretty strong.
The United States has some of the best doctors and hospitals in the world, but it remains the only high-income country in the world that does not guarantee health coverage. And I know there might be some alarm bells going off with some folks when I say this, because we also spend substantially more on health care than any other high-income country in the world. Why do you think that this is such an issue here? This might get a little political, but is it also mechanics, logistics as well? What do you think?
Well, so it's interesting because we have seen that we don't guarantee coverage in this country. We've seen an all-time high in the amount of coverage that we have. So the amount of uninsured individuals reached an all-time low in 2022 at 8%. So 92% of individuals are covered. But there's still clearly significant issues, exactly with what was revealed from this survey that Kaiser Family Foundation did. And what it's really revealing is that it's not so much whether an individual is insured or not, because we've got over 90% are insured, but it's really underinsurance. And that essentially, a survey was done that revealed that 23% of working age adults, while they are insured, are underinsured, meaning that their co-pays and their co-insurances are so high that they just can't afford to pay for the care, and then they're delaying that health care. They're not getting what they need. And as to the ultimate cause of all of that, a lot of it comes down to we've got a lot of profit taking happening from the insurance carriers. And like I said, I mean, if the insurance carriers were offering the best plans that they'd ever offered and at the same time reporting record profits, then it wouldn't be a problem. But they're offering the worst plans that they've ever offered and reporting record profits. Well, that indicates that somebody's winning here, and it's not the consumer. It's not the employer. It's not the employees or the members on the plans.
Yeah, and I'm sure a lot of folks watching right now are probably nodding their head in agreement. May hit close to home. Eric Calciano of New City Insurance, thank you so much for being with us and sharing your insight. Appreciate it.